sublingual, since I talked about the tongue, so it's also important about the sublingual region, which is the region that is under the tongue and is a part of the floor of the oral cavity. And it's important, extremely space in the orofacial region. Usually we have three structures in the floor of the mouth. One of them, which is separating the floor of the mouth from the outside, which is the submandibular and submental region. It's the fan-shaped muscle, which is called mylohyoid muscle. This is very, very important muscle. This is very important, which is separating the floor of the mouth, separating the oral cavity from the outside, yes. And of course, in the posterior margin of this mylohyoid, which is a free margin, there is a communication that it's a place of the spread of infection that I will show you, yes. So that is the one thing. The other one is the geniohyoid that we already mentioned before, that is below the genioglossus. Genioglossus is superior mental spine. The inferior mental spine from the symphysis inner surface is the geniohyoid. And finally is the tongue. So those are the three muscles or three structures that they are important in the floor of the oral cavity. And of course, in the floor of the oral cavity, you can find the sublingual gland, the hooked shape anterior process of the submandibular gland that is going above the free margin of the posterior margin of the mylohyoid, and the ducts of them. Yes, so this is a view through the floor of the mouth. So then those are the three structures. So this is the fan-shaped mylohyoid muscle from the mylohyoid line, which is making exactly the floor of the oral cavity separating. And above that, immediately you see the geniohyoid muscle, this cone-shaped muscle, and above that you see the genioglossus, which is, as a matter of fact, now you are in the tongue. Yes? So these three, one by one, from the caudal to the cranial part, the mylohyoid, geniohyoid, and genioglossus, and so on, the muscle, intrinsic muscle and extrinsic muscles of the tongue. They are there. This mylohyoid muscle that also is a muscle of the suprahyoid muscle, which is the next chapter, is a short chapter that hopefully we finish today. It's the, as we mentioned, is the muscle that is coming from the mylohyoid line, is going downward to the hyoid bone. So that's why, since it's above the hyoid bone, is a part of the supra group of muscles, which are called suprahyoid muscle, yes? And it's very important. And the connection of left and right mylohyoid muscle is this dense connective tissue, which is called mylohyoid raphe. Yes? This is extremely important, that in a while I will tell you why. And as you see, the posterior margin of the mylohyoid, here and here, is free. So that's why through this posterior margin, there is a communication from outside to the inside of the oral cavity. And this is the very main source of the spread of infection from oral cavity to the outside, or from outside to the oral cavity. Don't forget the free posterior margin of the mylohyoid muscle. And this is the place that the submandibular gland that is outside under the mandible is turning over the mylohyoid muscle and is going inside to the oral cavity. So this is the mylohyoid muscle. As the suprahyoid muscle is depressing the mandible and opening the mouth, that we mentioned it in the TMJ. Yes, the group of the suprahyoid muscle, they are making the depression or opening of the mouth together with the initial function of the lateral pterygoid muscle, which is attached to the articular disc and capsule. And also it's participating to elevating the hyoid bone, because it's pulling the hyoid bone. It depends on if the mandible is fixed, the hyoid bone is going up. If the hyoid bone is fixed, the mandible is going down. And this is important for the phonation and with the swallowing also. And since we have mylohyoid muscle, the innervation of the mylohyoid muscle is by the mylohyoid nerve, which is a branch of inferior alveolar nerve. Before the inferior alveolar nerve is going to the foramen, which is mandibular foramen. Yes, be careful. Mandibular foramen is not the site for the passage of mandibular nerve. Mandibular nerve is coming out of the skull through foramen ovale. And tomorrow you have a test, yes? And it's going through the mandibular nerve, then it gives a branch which is inferior alveolar nerve together with the artery and vein. They go to the, but before it goes, it's giving a branch which is passing through the mylohyoid groove here, which is going and supplying the mylohyoid muscle. So mylohyoid muscle is innervated by the mylohyoid branch of the inferior alveolar nerve, which is itself branch of mandibular nerve. Is very important. So next muscle of the also is our topic, which is the geniohyoid. Is another muscle of the suprahyoid muscle, and as we mentioned, is the cord-like muscle, which is coming from the inferior mental spine, and it's going to the hyoid bone, to the body of the hyoid bone. And this muscle, as you see, is superior to the mylohyoid muscle in the floor of the mouth, and inferior to the genioglossus muscle, which is coming from the superior mental spine. Yes, so the function is the same. So it depends on which bone is fixed. So usually, if the mandible is fixed, so it's pulling the hyoid bone, and which is attaching to the larynx forward during the swallowing. The other one, if the hyoid bone is fixed, is depressing the mandible and opening the mouth for this muscle. This muscle has a very interesting innervation. It doesn't, it's not innervated by any cranial nerve. It's innervated from the spinal nerve that in the nervous system we are going to discuss. And this spinal nerve that is innervating the geniohyoid and one more muscle, which is infrahyoid muscle, and is the thyrohyoid muscle, is innervated from the segment of the spinal cord C1. It's the first cervical segment of the spinal cord that in the next semester we are going to say is innervating the geniohyoid and thyrohyoid muscle, and this nerve always is going along the hypoglossal nerve. Yes, so it looks like that hypoglossal nerve is driving. He see the C1. He take the C1 together with the car and they go. So the C1, it's carried by the hypoglossal nerve, but the origin is absolutely something else than the nucleus of the hypoglossal nerve and this thing. And it's supplying this geniohyoid and the thyrohyoid muscle, that one of them, the geniohyoid, is suprahyoid, and thyrohyoid is the infrahyoid muscle. And this is the details of these two muscles, and they are the important muscle of the suprahyoid muscle that in a while I will show you. This oropharyngeal triangle that I mentioned, that several structures they passed, again, it's this triangle which is between the mylohyoid muscle, the posterior aspect, superior constrictor muscle of the pharynx, and middle constrictor muscle of the pharynx. Yes? So between them there is this triangle, which is called oropharyngeal triangle, And these spaces for us always is important. Why? Because there is a space that the pus, exudation, metastatic cells, they are going there, and they are spreading there. And then it goes to the danger area or dangerous area that we are going to tell you next week, that it can be threatening of the life. And through this triangle, it passed two muscles that already we said, hyoglossus, styloglossus, the vessels, the lingual artery and vein, the nerves, lingual, hypoglossal, glossopharyngeal, and lymphatic vessels. So those are important. And through the posterior margin, free margin of the mylohyoid, it's passing this hooked or anterior process of the submandibular gland, which is very nice. You can see here that is making a hook, the submandibular gland, and is going over this free margin of the mylohyoid, and from there it's sending the submandibular duct, which is open to the caruncle, the sublingual caruncle. And here is very important, again, a topographical relation, that this submandibular duct is crossed by lingual nerve, and lingual nerve always in this region is crossing and is going under the submandibular duct. This is a schema of the sublingual region. I don't know if you can recognize, this is the hyoid bone, this is the mandible, this tooth, and in the center here we have two muscles, the geniohyoid and genioglossus. Lateral to that is the hyoglossus muscle. Here is the mylohyoid, which is making a floor, and this is the styloglossus, and those are the intrinsic muscle, the longitudinal, superior, inferior, vertical, and transverse, yes? And the position of the structure between the hyoglossus and genioglossus, there is a lingual vessels. Between the hyoglossus and mylohyoid, it passes submandibular duct, lingual nerve crossed, going inferiorly, the hypoglossal nerve in the floor, and vena comitans nervi hypoglossi vein accompanied with the hypoglossal nerve, and of course the sublingual gland. Yes? So this is the border of the sublingual region, if you want to say. Above is by the mucous membrane, below by the mylohyoid muscle, laterally by the mandible, medially by the muscles of the tongue, and anteriorly mandible, posteriorly is free margin. So this is the details of the sublingual region. You need to know this borders, dentistry mainly, and this is the content that already we mentioned it about the sublingual gland is located, submandibular duct is located, lingual nerve is located, sublingual or lingual vessels that they give this sublingual branches, hypoglossal nerve and the vein accompanied the hypoglossal nerve and anterior process, or this hooked part of the submandibular gland. They are all the content of the sublingual region that once more here in this picture, maybe it's helping you. Then it's very important, and in a while I will show you why it's important. And this importance is for the spread of infection that easily can kill the patient. And we had it also. It's not just here on all of the world. So there are some spaces here under the tongue. Between the genioglossus, geniohyoid, here there are the space. Between the hyoglossus and genioglossus, there is another space. And another space also is between, for example, here is geniohyoid, genioglossus, yes? And those spaces, they are median, basal, paralingual, and transverse fissure. But for you, it's important that to know that is existing between these muscles some spaces. Because if its bone is stopping the spread of infection, yes? But if it is a space, loose connective tissue, the pus is going wherever, yes? And this is the dissection that we will show you between the genioglossus muscle. You see this median basal intermuscular lingual space. This is the vertical space. And this is the section that the submandibular duct, this is the hooked shape of the submandibular gland, which is giving the submandibular duct to the sublingual caruncle. And here, from the infratemporal fossa pterygomandibular space, is coming down and crossing and is going down the lingual nerve. Very nice. So here we already mentioned it, and here is the submandibular duct that is going to the sublingual caruncle, and here is the place of the duct which is open to the sublingual caruncle. Another name for the submandibular duct is Wharton duct. Is approximately 4 or 5 centimeters, and at the level of the caruncle, the diameter is becoming very narrow, which is 1 millimeter. That we already in the salivary gland we said it, that is the place of the infection. And here is the below region, that if I remove the skin, so you have the anterior belly of digastric and mylohyoid, and then if you cut the mylohyoid, you will reach to the sublingual space, yes, because it's separating it, yes. And this is important. Why? Because, for example, the dissection in topography that next semester you are going to dissect, this is the skin, platysma, the superficial cervical fascia or investing layer of the cervical fascia, anterior belly of digastric muscle, mylohyoid muscle, the geniohyoid and genioglossus, and then the muscles of the tongue that we are going to discuss. But here, very nice, the hook shape of the submandibular gland, which is communicating the submandibular region below the mylohyoid and the sublingual region above the mylohyoid. And this is important for the spread of infection. The tooth infection can kill the patient. A lot of people, they can laugh, but it happened and again it will happen if you don't treat it. So the place that the apex of the tooth, they are above the mylohyoid muscle attachment, so the infection, it goes to the sublingual space, to that space that we said. And usually there are these teeth, premolars and first molar and the medial root. But the roots that they are located below the mylohyoid, it can spread it to the submandibular region. So you have sublingual abscess and submandibular abscess, yes. And in X-ray you can, or CT scan, you can see the position of this mylohyoid. And why is important? It's that you have to know this information, how to treat this abscess, yes. So this is, for example, a dissection of the sublingual region. As you see, we are cutting the mylohyoid, and here is the patient that it had a tumor in the sublingual region. So it's not that he died and we dissected. No, it's a different picture, yes. So what I wanted to say, that this is the dangerous, it's called Ludwig angina, that if bilaterally all this space under the tongue is infected or occupied, and submandibular region also is occupied, this patient slowly is pushing the tongue toward the pharynx, closing the airway, and this is a state of emergency. It's called Ludwig angina. Angina is different than angina pectoris that you have it in the heart, yes. Angina, it means that the feeling of suffocation. The patient cannot breathe, yes. Those are the things that the ambulance is breathing emergency. And what you have to do, and if you look at the tongue, under the tongue is swallowing, the elevation all over is the pus. And how to treat? I cannot cut it from the inside by the scalpel, because I can cut the lingual artery, lingual vein, hypoglossal nerve, lingual nerve, submandibular duct. Yes? There is a better place here, mylohyoid raphe. Yes, we cut here. Here is the picture. You can go to this space and you can remove the drainage. Here is the patient that we had it So here you cut it, you remove the pus, and you put the drainage, and you save the patient's life. This is since we are in the sublingual region, if you see under your tongue usually, or in the lower lip, something looks like a belly of the frog. It's called ranula. So that's why the name is arising of this thing. This is the rupturing of the small salivary gland that is accumulating in some fibrous connective tissue that is elevating, is very transparent, and is called ranula. Is on the floor of the mouth. It's called ranula. And in the lower lip, for example, is mucocele, they call it, by the trauma. Yes, somebody biting the lip. So this is the first term, and then the following that we already discussed, most of them, the suprahyoid muscles that we said that generally they are the muscles that above the hyoid bone, and there are 4 muscles: stylohyoid, anterior posterior belly of the digastric, mylohyoid, and geniohyoid. The function is raising the hyoid bone during to the swallowing. And they are taking part to the formation of the different triangle in the neck, which is submandibular triangle and the submental triangle here. And this is the recapitulation of the origin insertion of these muscles that already we mentioned it. Geniohyoid we mentioned, mylohyoid we mentioned, that the innervation of them is very important, be careful. The stylohyoid muscle and posterior belly of digastric, those are because embryonic development is from the second pharyngeal arch. They are innervated by fascial nerve, extremely important. Then the rest of the muscle, they are coming from the mylohyoid and anterior digastric muscle. They are innervated by is developed by the first pharyngeal arch, so it must be innervated by trigeminal nerve, which is, for example, the mylohyoid nerve. We said it's branch of infrahyoid nerve, which is branch of the mandibular nerve. It is. And remaining the muscle of the supra and infrahyoid muscle, they are from the spinal nerve that is arising from the spinal cord that already we mentioned it. Stylohyoid, we said it's the same, but it's coming from the styloid process to the hyoid, is elevating the body of the hyoid bone during the swallowing and pulling posteriorly and superiorly, innervated by fascial. The digastric muscle has 2 belly, the anterior and posterior. We said about the origin, the digastric fossa and mastoid notch. You have intermediate tendon, which is pierced by the stylohyoid muscle. The posterior belly is innervated by fascial. Anterior belly is innervated by mylohyoid nerve, branch of inferior alveolar nerve. Then mylohyoid we already discussed. Geniohyoid we already discussed. Infrahyoid muscle, those are the group of muscle that they are under the hyoid bone, and they are making for the muscular triangle of the body. And this is the omohyoid, that it has 2 belly. Be careful, superior and inferior, not anterior and posterior. The digastric has anterior and posterior belly. Omohyoid has superior and inferior belly. And sternohyoid, sternothyroid. So those are sternohyoid muscle. This is they call it strap muscles according to the shape, and innervated by the deep ansa cervicalis, and omohyoid muscle, which is lateral to the sternohyoid muscle. It has superior belly and inferior belly. Be careful, this omohyoid muscle is playing role for the division of the region of the neck. So this is anterior or muscular or omotracheal triangle of the neck. And here is very important triangle of the neck by the sternocleidomastoid, posterior belly of digastric, and superior belly of omohyoid. Is a carotid triangle, extremely important. And inferior belly is dividing this posterior triangle of the neck to the trapezius, or here call it occipital triangle, and here is the omoclavicular triangle of the neck region. So this is important. Also, the division. Finally, this thyrohyoid muscle, which is this muscle, which is innervating together with the geniohyoid from C1 carried by hypoglossal nerve. This is another infrahyoid muscle, and sternohyoid, which is from the inner surface or posterior aspect of the manubrium of the sternum. It goes to the oblique line of the thyroid cartilage and continue as a thyrohyoid. So sternohyoid, omohyoid, superior belly, inferior belly, sternothyroid, thyrohyoid. Those are the 4 infrahyoid muscles. All of them, they are generally innervated by the spinal nerve from the C1, C2, and C3, that they make a loop and they make the ansa cervicalis that we are going to say, the deep ansa cervicalis we are going to say in the chapter of the nervous system. The blood supply of the supra and infrahyoid muscle, they are all one of the branches of the external carotid artery. Yes, fascial mainly, superior thyroid, lingual artery, occipital artery, posterior auricular artery in the cardiovascular system you can see. And the venous drainage superficially drain to the external jugular vein or anterior jugular vein. Deeply is going to the internal jugular vein. Be careful, internal jugular vein, that you know it, that is coming from jugular foramen, is deep. External jugular vein is superficially under the skin. You can see it in the anterior and lateral aspect of the neck region. Thank you very much for your attention.